Alyssa, how are you doing?
Good, how are you?
I'm good. Has the doctor been in to see you yet today?
Yes, he has.
Okay, perfect. So he wanted to send me in to talk to you and just give you a little bit more education about the medication that we're going to put you on. Have you ever heard of heparin before?
He did mention something about
Okay, so I brought you a pamphlet in to give you a little bit of information about it.
Perfect.
And then I also wanted to talk to you a little bit because there are some complications that can happen with taking heparin, as it is an anticoagulant, which most people would know it as a blood thinner.
Okay.
So there's a few tests that we're going to do that are blood tests before we get started, as well as any concerns. Have you ever had hypotension, which is low blood pressure, or a high heart rate, which is tachycardia, before?
Not that I'm aware of.
Okay, and have you ever taken heparin before and had any contraindications or problems with it?
I've never had it before, no.
Okay, so we're going to do a couple of those tests like I mentioned earlier, and one of them that we're going to do is a PTT test, and it's to see how long the clotting factor is for your blood, and then we want to, while you're on the medication, maintain 1.5 to 2 times what that original level was to know that it's therapeutic to prevent any further blood clots.
Okay.
Another one that we're going to do is we're going to monitor your heart rate and your blood pressure throughout. And then we want to make sure that you're super careful with any activities or anything that you're doing, because while being on heparin, you are at an increased risk for bleeding because it's preventing your blood from clotting. So during that time frame, you want to resist using any razor blades or anything like that that could cut yourself, or any activities that can cause harm. During that time frame, we would say that you should use electric razors, soft brushed toothbrushes when you're brushing your teeth to make sure you're not making your gums bleed. And then if you do get any cuts or anything that lasts more than 45 minutes, to make sure you're coming in to see your doctor.
Okay.
And then you want to make sure that you're looking out for any bruising. If you're having black tarry stools, that's an indication that you could be bleeding. And then if you're throwing up and it looks like coffee grounds, that's also something to look out for. Do you have any questions so far on that information?
I don't think so.
Okay. So with this, we're using it because you have a pulmonary embolism, which your doctor educated you on that earlier. So this medication is to prevent, hopefully, any more from reoccurring while you're on this medication. And it also depends with your doctor how long you are on it for. So it is definitely something that you could go home on, or potentially changing what medication you're on.
Okay.
Do you have any questions for me?
No, I don't think so. Thank you for explaining everything to me.
Of course.